Okay, this video has to do with the physical assessment. Now, I know that last semester you guys did the narrative, but we use this pre-filled out one. So if you have this piece of paper, get it out so you can look at it. You can see that at the top it has the patient statistics and it has the spot for 4 set of vitals. Minimum, you will do 2 sets of vitals every semester day. You'll do it with your first assessment and you'll do another with your second assessment, which will be about noon. And then there's a body system square for each one. And the top part of that, like this for respiratory, is your first assessment, and then this lower one is for your second assessment. So this is your 7:30 assessment, and this is your noon assessment. So you have to put if things are changed or unchanged. So we chart by exception. So if everything is good, then you put within normal limits. If everything isn't good, then you check the box within normal limits except, and you list that. Some things that are missed is they have a tele number in the cardiovascular section. In the respiratory section, all those little boxes are for vent patients, or a lot of them, so you won't worry too much about those. In the GI section, it has last bowel movement and a line, and that's for the date. So you record it as day, month, year, not day of the week. In nutrition, you record the percentage of meals that they've eaten. In the GU renal reproduction, this is urine output, okay, even though it's below the Foley catheter, whether their urine output is Foley catheter or in the toilet, it needs to be measured in milliliters. So this is during your shift. So you don't look this up on the computer, you measure it yourself. And since our day ends about 1400, the nurse will not have measured it. So a lot of times we're the ones measuring it. So that is something that I look for in every set of clinical paperwork, and that gets overlooked a lot. On the back side, we have some more systems. So we have the psychosocial, we have skin and wound, and if you have somebody that has skin or wound issues, like when we're on the surgical floor, say that they have an incision, you want to document the dressing. You don't have to take the dressing off. For musculoskeletal, you put if they have any assistive devices. Invasive lines is a little tough for you guys. So it has the type. Usually it's like a PICC line, a peripheral IV, a location, and then inserted means the date, because a peripheral IV is only good for 4 days. Now the pain section, you should be assessing your patient's pain with every physical assessment. So you'll do one at the very minimum with your first assessment and your second assessment, and you'll see there's another row there. So you can do one more. You could do another one and just fit it on. And you always want to reassess. If you don't reassess, then it looks like you're not doing anything or that you don't care. So you give whatever med and then you reassess. Now this intake and output is really hard for us to do because not all of the INOs get recorded in milliliters. So if it gets recorded as one void, say it doesn't get measured, and it's acceptable to record it that way. If nurses have recorded it that way for several days, then we cannot do an INO assessment. So we just do our best on that section. This section with the notes is anything that doesn't fit. Things that I like to see down there is if your patient gets discharged, put that they got discharged. And then that way when the reassessment times are all blank, I'll know that it's because your patient was discharged and you couldn't reassess them. Other notes that are good is if your patient leaves the floor. So if they go for surgery or they go for an MRI, just write that they left and what times they were gone. If you don't have anything there and it's not your main patient and you want to put a little S-bar, that's great. I love it, but it's not required. All right, let me know if you have any questions.